So the session today will be recorded. So my name is Mina. I am a pharmacist in Sunderland Royal Hospital, the current Vice Chair of Sustainability at Guild of Healthcare Pharmacists and co-founder of Pharmacy Declares. So as I said, today's session will be recorded so you can watch it back at a later date should you need to pop out and do something in the meantime. And I'm grateful today. I have Nuala Hampson, who will be kindly managing our Q&A chat box. So if you have any questions for the panelists, please pop it in the icon at the bottom of your screen for any questions directed at our panelists. We might not be able to answer them all due to time constraints, but we'll try our best to. And now, if I can try and run our first poll of the day to see where everyone's coming from. So if everyone can see the poll on your screen now, where are you dialing in from? And what is your profession? Just to gauge an idea who our audiences are today. So feel free to use the chat box. Some of you have started already to introduce yourselves. There is an option to save all the chat at the end if you click on the 3 dots above your type box, should you want to find any links or documents later that might be useful to you. Now let's see. I'll just quickly end this poll as everyone finished answering the poll question. Oops, still answers coming through. Okay, so most people from England, a few from Scotland, EU, international audience. So we have a few pharmacy students today, mostly pharmacists and pharmacy technicians as well. Welcome, everybody. And now, so I'll run our second poll of the day, just to gauge everyone's basic understanding of where we all are in the room about the potential health impacts due to climate change and how they will affect healthcare provision in the future. So just to let everyone know as well, we aim to have a quick 10 minutes break at 11:20 in the morning, just to give us all time for a breather. I am aware that the raise hand function is available to everyone, but we will not be using that today. So if you have any questions, like I say, from for the panelists, just pop it in the Q&A icon at the bottom. And we have members of Pharmacy Declares as well manning our chat box. So should any questions arise in there, it will be directed to the Q&A icon. Now, poll answer. So a mixture. So there's a mixture of not aware, some people somewhat aware, and equal people are very aware. So very good. We have a very informative audience today. Now, just exit the screen. Okay, first up today, we have Tracy Lyons, who is the founder of Pharmacy Declares, a pharmacist at University Hospitals Dorset and UK CPA Environmental and Sustainability Advisor. Tracy has been calling for climate actions within the pharmacy world for a number of years now. We will hear from her today. What is the climate and ecological emergency? What are the associated health impacts of climate change? Why must pharmacy act now? And over to you, Tracy.
Thank you. So I'll just try and share my screen. Mina, I think you're still sharing yours. Amazing. Let me just try this again. 1 second. Can everybody see that? Can a thumbs up? Brilliant. Thank you so much, everybody. So I just want to reiterate Mina's welcome. It's amazing to be here today. Pharmacy Declares is a relatively new collaboration. We've been going for less than a year. So to be here today as part of an international network of pharmacy professionals who really want to make a difference is just breathtakingly fantastic. And we want to say thank you to you for wherever you've dialed in from and whatever the time of day it is for you. We really do appreciate it. We have some amazing speakers today, real leaders in their field. So my job is really simple. My job is to help us crystallise our thoughts about why the sessions that we're going to hear are so, so important. And I think because at work, you know, in our national plans and our local green plans, we talk about sustainability a lot, but we have to take it one step further and realise that the reason that we need sustainability programmes is because we're in something called the climate and ecological crisis. And as a health professional, we all need to understand that this is the single biggest health threat that we will ever face. And so what the speakers are going to give to you later on aren't just feel-good projects. They're not things that look good on your CV. They are tangible ways to make a difference. As we go forward, you know, it's our job to recognise the potential in these projects. So today I'm just going to have a quick run through on the health impacts of the climate and ecological crisis. So the first thing we need to know is that the science behind this is extremely well established. We've had over a century of warnings that burning fossil fuels would be bad for human health. You know, but despite this, we've been ever more creative in finding new fossil fuels to churn through. We've got fracked gas and tar sands now. And despite all of this, despite the warnings to governments and corporations, we still keep following the same path, and we have done for a long time. And you can see here that consequently, emissions from burning of fossil fuels have continued to rise. You know, there are a number of different fossil fuels, and they release a number of different greenhouse gases. But this graph shows carbon dioxide emissions over time. And you can see that since the start of the Industrial Revolution, when we really started eating them up, emissions have just gone higher and higher. And consequently, the global temperature rise has increased as well. The slight dip at the end, you can see, is from when we were interrupted by a global health pandemic. But if I were to run this graph again, you would see a slight uptick in the graph as various COVID recovery plans have been enacted. But over time, you know, people with health and well-being at the heart of what they do have tried to make a positive difference. And in 2015, there was an international treaty and agreement to try and limit greenhouse gas emissions and to try and prevent global temperatures increasing above 1.5 degrees above the pre-industrial level. And, you know, you have to understand the significance of this. This agreement was met purely to safeguard life on Earth. And we talk about plus 1.5 degrees as this magical number now, something that will keep us safe and protect us from harm. But as health teams, we need to know that even at 1.5 degrees, we're going to see dramatic changes to the world around us. And we know that now because we're already at plus 1.2. And you can't turn on the news these days without seeing some kind of climate-related event, whether that's floods in Germany, whether that's wildfires, or the one that really struck home with me over the last year was extreme floods, extreme rainfall in China, which caused people to drown on the underground trains because they couldn't get out in time because it came down so heavily. So we need to know what we're facing and what we can do to mitigate these kind of events. The first thing that we always think about with climate change is heat, isn't it? Because, you know, originally it was global warming, that's what we used to call it. And we know that as emissions go up and as the temperature increases, we're going to see an increase in the frequency, intensity and duration of heat waves. My own focus on climate change really came about because I lived in France in 2003 when a very severe heat wave affected Central Europe over one summer. And more people died in one night in Paris from the heat wave than in any one night during World War II. People just couldn't cope with the intensity of the heat and the environment that we live in. And as the heat rises, we know that each fraction of, as the temperature rises, each fraction of a degree will increase mortality and morbidity. As the heat continues, we know that it will impact food and water supplies. From experience around the world, we know that when food system failures occur, you have malnourished patients, They are patients that can't absorb the medications when we get to them. And really, in a heartbreaking situation, you have childhood growth stunting. The National Farmers Union in the UK, like farmers unions worldwide, have already started to report food system failures. And the UK Environment Agency has said that we are likely to have insufficient drinking water to keep people alive by 2045 in the UK. So as health teams, we have to think, how are we going to look after our patients if they don't have enough water to stay hydrated? And ultimately, we know again from situations around the globe that when food and water become in short supply, people start to fight over what's left. And so we might have to worry about not only what climate change is doing to us, but what it might make us do to each other. The increased temperature and the lack of water will also increase the risk of fires. And in the UK, I know we focused a lot on the fires in the Iberian Peninsula and Australia, but you can see from this NASA map, which was taken, which records all of the fires over 1 month this summer, just 1 month, they represent just a tiny fraction of the problems that the fires that have occurred globally. And you can see that everywhere from the Arctic Circle to Africa are affected. It's going to be more of a problem for us in the UK too. I've borrowed this map from the National Trust, which is a heritage organisation for our international visitors. They look after properties and grounds, and they undertook a risk assessment of their portfolio. And you can see that the temperature in the UK is going to change quite significantly over the coming decades. We think that summer temperatures in the UK are going to go up by about 7 degrees if climate change is unchecked and if it continues. I don't know where you work, but currently where I am on hot days in the summer, the temperatures in my hospital and in my health clinics can be in the high 30s, sometimes in the 40s. Which from a pharmacy point of view means none of the drugs are stored in licensed conditions, the patients and the staff suffer, and we know that staff in these conditions make more mistakes, understandably. So it's something we'll have to adapt to as we go forward. Climate change will also change the safety of the very air that we breathe. The fires outside their immediate risk to life and property contribute some particularly nasty toxins and particulate matter to the air, and these can travel for hundreds of miles. We've spoken to colleagues who are based in Northwest America, in Oregon, and they've described, even though they were living quite far away from the fires, staff couldn't leave their homes to go to work because when they did, they started to suffer health problems. And we know that this impacts on people who have no underlying health conditions at all. So it's a matter for everyone. The increased ambient carbon dioxide in the air will also increase the respiratory allergens that we might encounter, fungal spore production, allergenic proteins in pollen because the plants grow for longer and faster, etc. But the real villain in the piece are the fossil fuels themselves, because not only do they drive this situation, but when we use them, they make the air toxic to breathe too. And we know that last year, when the emissions were down, remember when everything was clear and the skies were clear and clean, fossil fuel air pollution was related to nearly 7 million deaths globally. And I've listed a few of the ways in which the ill health can be enacted, but we really have to think of fossil fuel air pollution as something that affects us from our head to our toes. And even in utero, the unborn child can be affected. The little girl on the picture was the first person in the world to have air pollution listed on her death certificate, and she lived in London. When you might associate this with, bad air in a congested city, but actually this is a problem that's going to be encountered anywhere that we have a lack of green space and we have a preponderance of fossil fuel driven cars and industry. The increase in temperature and energy in the air will also mean that as climate change progresses, we're going to see an increase in wet weather events too. So, and likewise with the heat waves, we're going to see an increase in frequency frequency, duration and intensity. It's anticipated that in the UK, over the coming decades, the precipitation will go up by nearly 70%. And the meteorological predictions are that in Europe, over the coming decades, we're going to see tropical style cyclones. And this is a problem for us because so much of our infrastructure will be at risk. 7% of our UK hospitals are in flood risk zones, nearly 10% of GP surgeries are, as well as millions and millions of homes. And we have to remember 2021 as the first year that hospitals in the UK were actually evacuated because of this. So not only did we have to treat extra patients, we had to take patients out of the hospital because of these climate change events. And the storms are going to be aggravated by an increased level of sea rise. The global warming is melting polar ice caps, and it means we have an increasing rate of sea level rise at the moment. That's going to affect a lot of us because as a species, we like to live beside the coast. And it's going to not only affect people's homes, but the infrastructure we need to provide health. So things like power stations and transport lines, etc. There's a great tool that allows us to visualize exactly what sort of areas are going to be at risk. And you can see even the big financial centers like London, places like New York are going to be very heavily impacted. Our European neighbours are going to have to face this full on. It's going to be a significant issue for them. And further afield, even the powerhouses of the world are not going to escape this. This is going to impact millions of people globally. So they're just a few of the health issues related to climate change, but there are more. We could talk about dermatological conditions or the change in infectious diseases because of the change in the geographical spread of things like mosquitoes. We know that in the UK, we're going to have to start treating malaria in the coming decades. So we need as much help as we can to try and mitigate all of this. And so the other thing we have to think about, as well as climate change, is the ecological situation we find ourselves in. Because I think it's so easy, I think a lot of the time we're focused on carbon, but we have to remember that the ecological environment that we live in is as important to health as anything else. We have profoundly changed the footprint or the natural environment that we live in. And we've changed the land, the soil, the sea and the air. And this is changing removing the natural buffers, the environmental buffers that normally keep us safe from our own activity. So as we go forward, we need to look after these things as well, because they provide us with this suite of services to provide us with essential things like food and clean air and clean water and protection from natural threats such as infectious diseases. As healthcare professionals, we need to get over the view that it's unscientific or it's not necessary to look after all of the flora and the fauna that surround us. It's really important that we realise that all of these tiny things, these tiny bugs, the plants, the oceans and the rivers are there to keep us safe. And if we look after planetary health, we will look after human health as well. And we do need their help, because although at the forthcoming COP meeting, everyone will be talking about targeting plus 1.5 degrees. The UK government and governments globally have been advised to prepare for a plus 4 degree world by the end of the century. And this is not just a plus 4 degree rise in the outside temperature, which means you can take off your jumper. We have to think about this in terms of a whole body system rise. So if your body temperature were to increase by plus 4 degrees, you'd be very seriously ill. And the same can be said of the planetary health system that we need to look after. Because we think if we get to a plus 4 degree world, it will look a little bit like this. The red zones are underwater, the brown zones are uninhabitable, the yellow zone's a desert, and what's left we might think of as safe to start with, but it's absolutely not. You know, you can see that even as we head towards 1.5 degrees, we're going to be facing a shrunken, scorched patch of land, and we're going to be looking after an increased number of sicker patients with fewer resources. So we're going to be at the forefront of looking after climate refugees. Everything we can do to stop this has to be done. And so if this is the first time you've come across this, or even if it's not, I'm sure a range of emotions are running through your head at the moment. And over time, you'll cycle through different stages of this, but it's well documented. But this is where we change the tone of the conversation, because the one thing I can positively guarantee you, that action mitigates anxiety. And so it will not only help you, it will help your patients and your community. And there is so much that we can do. And as we're health teams, I always like to think that the way to think about it is a medical diagnosis. We know what is wrong. We know exactly what has precipitated this. We have uncontrolled greenhouse gas emissions, and we have a lack of respect for our natural world. So that's what we need to do to change it. If we think of our environment as a patient, we know what's wrong with them, and we know how to look after them. And this is where we can make a massive difference. So by listening to the speakers today and taking their advice, we can start to decarbonise our health systems and protect our local communities. But as healthcare professionals, we have this amazing platform. We are respected in our community. People and patients trust us. So if we start to talk about what needs to be done and demonstrate what we are doing, we can deliver healthcare that goes far beyond our services and far beyond medicines. And so we hope that as part of this international collaborative, we can be creative disruptors to the system. We can bring about some really fundamental positive change. And we hope that you will join us on this journey. So thank you very much.
Thank you so much, Tracy. No matter how many times I hear a presentation, it still gives me this this overwhelming feeling of what could happen if we don't act now or take actions ourselves. So that's why I'm here as part of Pharmacy Declares, trying to get people aware and hopefully inspire them to take actions. So I don't think there's any Q&A that's come through for you, Tracy. So you can sit back and relax for the next presentation.